Medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. We are going to be talking a little bit about the holiday blues this evening and ways to seek help, because it couldn't be timelier part of the year to talk about that. I'm here with Catherine Huynh, LCSW, and I learned last week that's a licensed clinical social worker.
Right.
So, Catherine, welcome to the program. How are you doing this evening?
Thank you for having me. I'm doing very well. Thank you.
And thanks for making the drive from JFK Medical Center's North Campus, right on 45th Street, right off the Interstate 95 in West Palm Beach. That's right. JFK's North Hub. And you are the outpatient program coordinator. So let's dive right into it. Please tell the viewers and listeners a little bit about what you do in your specialty there as outpatient program coordinator.
Okay. Well, generally what we do is we help people with mental health issues. So when you think about that, the gamut of mental health issues could be from depression to bipolar disorder to schizophrenia and thought disorders. So what happens is when individuals need a higher level of care, not so bad that they need to go to the hospital, but they need more care than, say, the community therapists and psychiatrists could provide in the community, we're kind of in between. We're intensive outpatient services. So we provide care for those who are experiencing mental health issues and mental health problems.
Okay, so, and then those are people that don't actually come into the hospital because it's outpatient.
That's right. Well, there's ways of getting into our program. Mm-hmm. Some people who are in the hospital, then they would step down, what they call stepping down, to our outpatient program. Because if when you're in the hospital, you're kind of getting stable, and then you have to go to the home. And when you get home, you still need to continue with treatment. So the recommendation is to provide intensive outpatient programs such as ours.
Individuals that are helped in the step-down program at JFK Medical Center North Campus, is that solely mental health issues or sometimes that substance abuse as well?
I appreciate that you made that distinction. We are a primary mental health program. Some people may have substance use issues. We don't treat those individuals directly. We do ask that if they have an active addiction, I would help them with other referrals to other community resources. But for those who had a history of being in recovery, we ask that they're 90 days clean and sober, and they're dealing with their mental health issues, we are able to service them.
Nice, and we're here with Catherine Huynh, licensed clinical social worker, JFK Medical Center North. It's jfknorth.com. Great website there. Catherine, are the holiday blues for real? Is this a real thing? Like, really the holidays, all this cheer and lights and festive and the music? And we were just talking about the music. And can it bring people down?
You know, when you think about individuals who are having depression, possibly due to grief and loss, we talk more about seniors in our community, right? People who are dealing with loss and grief recently have lost a loved one. Those holidays are even the harder times. Imagine people all around you are having cheer. You hear it on the radio, but inside you're dealing with depression. So it's a mixed feelings. So it is, if you ask me, I think it would be even harder because others aren't relating. They feel alone, that they don't think that others understand what they're going through. So the holiday blues is absolutely real. But when you think about mental illness, there's no time frame. There's no time that is good enough. As far as like when you feel this way, it doesn't matter what time of year it is. It's what is pervasive and what you're feeling every day.
People say it just hit them like a ton of bricks at any given time. And like that's a great point. Like it's not just this time of the year; it can happen at any time of the year. Yeah, you
think about say Thanksgiving. If you had lost a loved one, you have an empty chair at the table, or times where you would be celebrating because it's someone's birthday. You still have those memories of that individual. Again, if you had lost someone, or even say a breakup. You know, so it may not be loss due to death, but it could be a recent breakup. You're now alone. And or individuals who experience chronic depression. It's, again, any time of the year.
We're here with Catherine Huynh, licensed clinical social worker, again, at JFK Medical Center, North Campus. They're on 2201 45th Street in West Palm Beach. But Catherine leads the outpatient program. She's the coordinator there as well. We chat a little bit briefly about symptomology, and I was trying to look it up before we went on. What is that?
When you think about depression, these are actually the milestones when you think about them. Having a hard time with activities of daily living. Hard to do, say, self-care. It's hard to get motivated to literally take a shower, to brush your teeth. The things that you found were pleasurable, that you enjoyed, you stopped doing them. Having difficulty with just these simple tasks, they're much more difficult. So we're talking about anhedonia, inability to find pleasure. Those are generally those milestones as far as sadness, but to the point where you're not able to function.
Wow. And that I've read about that a little too. Can that affect when people eat? They maybe not taste the food as well, and they eat less because of that.
You may not have an appetite.
Yeah.
So those other symptoms are inability. It's both. Two extremes, right? Either you don't have an appetite or you overeat. And you think about that for everything. You either oversleep or you don't sleep too much. Those kinds of things are a disruption to your everyday routine, which will absolutely affect your mood and your quality of life.
Yeah, because depression can affect the way you're eating, the way you're sleeping, the way you're feeling, the way you're thinking.
Exactly.
It really attacks a lot of different things.
There's a physical and the mental and the physical connection. Totally.
It's such a resource having you on this program because of what we're hearing in this country with mental health issues, and to bring this to light is really great for our listeners and viewers. So if you ever want to check out this program, check out allcountyhealthcare.com. There's a radio link there, and you can go back and look at this program, or on their Facebook page, All County Healthcare Incorporated. What I'm saying is there's a library there, and you can always go back and check out what Catherine has to say, because this is a very important knowledge for everyone. How does someone's feeling down or blue, or maybe maybe it's just someone who has a friend or family member who's feeling that way and wants to help out as an advocate. How can people seek help? Okay.
I think that first and foremost, what I always find is that people have a hard time, possibly in the middle of the night. Someone that you want to talk to someone. I will always say that 211 is a wonderful source. 211 is across the nation, can help. You have someone to get through that difficult time in the middle of the night. Because what happens? It's not during the day that you have that issue, because you kind of probably are doing your thing, you're distracted. But in the middle of the night, you can't sleep. And for those who have severe depression, they may even think of self-harming, or even literally thinking about killing themselves. And when you have that deep, severe depression, the way we want to address that is to talk about it. call 211, talk to someone. So what we want to do today really is to reach that individual, the one that really feels like they're alone. And what I want to say is you're not alone. You could talk to someone and get through that difficult time.
So this is 211, just like 911, except the 2 in place of the 9?
So the 211 generally is kind of an information number. You can call for resources in the community. But if they find that, okay, wow, they're in need, you can talk with a mental health professional.
Oh, and it's important to talk things out.
Yeah.
We all know that.
Yeah.
Just talking things out in every point of life seems to help.
That's one way of doing it. Like I said, in the middle of the night, JFK North Campus as well as main campus in Atlantis, there is an emergency room side that deals with mental health. So if ever you feel that extreme, that you feel like you're unsafe, go to the emergency room. They will do their evaluation there to see if you would qualify for the hospital. That's another way of getting help immediately.
And that's when people can walk right in.
That's right.
There. And there's different ways to get there nowadays. I mean, family, friend can drive you, or the people can, find other points of transportation to get brought in, or just call that number and, talk to someone and get the help that maybe you or a friend or family member needs this time of the year. Because, it's great out there, and we'd, it'd be great if everyone, makes it through the holidays and other times of the year.
My phone rings all the time. Ask any one of my colleagues. But I want to pick up the phone because I know it could be someone truly who needs help at that time. And they took that gumption to even call to ask for help. And so when I pick up the phone, my thought is, okay, if I can give them hope, if I can give them instruction in what to do to get that help, absolutely I'm going to pick that phone up.
That's great. And we're here with Catherine Huynh, licensed clinical social worker, outpatient program coordinator at JFK Medical Center North Campus. It's jfknorth.com, and it's located on 45th Street. And then you said also JFK Medical Center in Atlantis, and I'll get that address as well after we take a break in about a minute. On the other side, I want to talk to you a little bit more about, so we have this program, demographic is mostly, I believe, baby boomers.
I have individuals 18 to 99.
Okay,
so.
That's okay. We have 18-year-olds listening too, and we have a few doctors listening, so we're grateful for them as well that have been on this program. So, I want to get into a little bit about that on the other side, and talk a bit about elderly persons' disorders, because I know with the changes in aging, there can be a lot going on as well. And then we can kind of talk about that. But let's take a quick break, and on the other side, we'll talk about those issues with Catherine Huynh, JFK Medical Center North, on the Living a Longer and Healthier show.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 2009996. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the Living a Longer and Healthier show. We're here with Catherine Huynh, licensed clinical social worker, JFK Medical Center, North Campus, off 45th Street, jfknorth.com. Catherine, how did you get into this role as outpatient program coordinator for JFK Medical Center?
I think that generally I like helping people, and to be honest with you, I didn't know a lot about group therapy, and that's generally what we're going to talk about next. As a practitioner in the community, I've always provided that kind of service, one-on-one talking with people. And when I learned about group therapy, recognizing the value of a group of people actually sharing, it made sense to me that it's another level of care that I had not been exposed to, that I was kind of intrigued by. And to be part of that, I'm so grateful.
And when group therapy,
Yeah.
when you hear other people's stories, sometimes it's easier to digest what you're dealing with or even what people around you are dealing
There are
with.
two scenarios. You think, wow, I'm not so bad. Or other people are going through the same thing I'm going through. I'm not alone. And again, when you think about people who need help and who feel hopeless, when you have other people going through similar experiences as you, it makes you feel okay, that you're not alone. Yeah.
And that's important as well. Now, these groups, is this something that the JFK coordinates as well?
Yes. So our program, we have two programs for outpatient. Essentially, we use group therapy as a way of psychotherapy. You think about individual therapy for psychotherapy. You and I having a therapy session, I'm the therapist.
Okay.
So generally, when you think about that psychotherapy through individual therapy, if you were the patient, generally you're kind of going this way, right? You're telling me what's happening, and I try to help you, kind of help you cope. Imagine this room full of people who are going through similar experiences. Now you've got a dynamic in the room where I'm hearing from other people who are experiencing similar experiences. You are hearing from them as well. The nice thing about group therapy is it builds this supportive and cohesive group.
Nice.
And in time, that individual that came in for help may be helping another patient. So it's very empowering for them to think, wow, I could help someone else. Then it gives them purpose as well.
And it gives them somewhere to go, right?
Yeah, absolutely.
Definitely, to get the help they need. How can people get involved or sign up, or do they go on the website here?
They can certainly go on the website, contacting us for the outpatient program. They can contact the hospital itself. I can give you my phone number. It's 561-881-2692. I coordinate the program. I also talk with people about what the program's all about. And it's always going to be also about insurance. People ask me about insurance programs and plans, what is covered. We do take Medicare and private insurance.
Thank you for sharing that.
That's very important.
I almost glanced over that. I probably would have, and that's great that you brought that up. And it's so easy to talk to you, so people need to give you a call. I mean, I'm talking to you right now. It's a great conversation. I definitely feel the passion in what you do.
Thank
you
you.
definitely have a lot of passion.
Well, I know that I had said earlier, whenever anyone calls me, taking the time to even navigate the healthcare system.
We talk a lot about that on this show.
Oh, my gosh. It's already
tough.
hard. You don't know where to go. You're calling to find help. So most of the time, if I talk to them on the phone or even have them in my office, if they don't even use our service, I have to help them through on how to get help.
Yeah, I was talking the other day on this show. Do you remember Rolodexes?
Yes, I think I still have one.
Yeah, I think I have one on my desk too. That's why I was saying.
Yeah.
It's like nowadays you really have to have your Rolodex loaded up. Sure, there's Google and everything else,
Yeah.
which everyone does right away.
Right.
But you need to know who a great neurologist is.
Yeah.
You need to know who a great cardiologist is. You need to know a licensed clinical social worker.
Right.
You need to know an orthopedic surgeon. I mean, these have to be And it's great to have if you already have that background, that library. And that's why we do this show. We take people on an adventure of health in a good way. We're taking you down that path.
And I want to go straight into that. When you think about mental health treatment, most people think, okay, what's that pill that's going to help me?
Yikes.
I'm going to say that's only half the formula for mental health treatment. Medications are going to help with the symptoms of depression, right? Those physical symptoms. I need a little bit of a boost to get me out of bed. I need help with sleep. I'm going to need help with being able to do the things and function. But the other half is psychotherapy. So I talked a little bit about individual therapy. That's one form of psychotherapy. Group therapy is another form. So you have to do both in order to get the value of mental health treatment. It's not just a magic pill.
Yeah, right? And always working on your mind, right? Finding things to do.
Yeah.
Individually wise. Yeah. I mean, a lot of neurologists will say, do Sudoku or do this or do that or do word games or
activities,
play chess. Stimulate the mind, but you also got to have a place to go when you're feeling down, kind of to talk yourself out of it in a way, or call 211 or call your program and then talk some more to someone else.
Well, in talk therapy, the approach that we use is called cognitive behavioral therapy. And to break it down, it means we're going to work on how you think and behave to have a better quality of life and perspective.
That's great, because cognitive is the thinking, right? Part of the brain.
That's exactly right. I think that I hear this a lot, and it's the patients that have taught me. When you are down and having a hard time, you could talk yourself into anything. In other words, your mind spirals down, and you get to that point where it's very difficult to function, and that's what we're trying to help in treatment. How do you change that perspective? Another thing a patient taught me is move a muscle, change a thought, right? Action,
definitely.
moving. It's about how do we retrain our minds for a silver lining and positive perspective.
Yeah, get up and move, right?
Yeah.
I mean, a lot of cardiologists would tell us that too, but a lot of people, when they get depressed, they don't want to leave the house. They don't want to leave their little tunnel there, but to get out, move, talk, walk, interact.
Isolation is exactly one of those key milestones when you think about depression. You are afraid. You want to stay at home. You want to stay in bed. And of course, how it's disrupting your life. You're not getting up to even eat. We talked about that as far as food. So the more they isolate, the more depressed they get. And that's what we're trying to battle. How do we get through that time so that you no longer isolate? Just coming to a program like ours allows you to have some activities on your calendar. So you're getting up for a reason. Right?
Which in turn will make you want to do more things as you build.
Well, we hope is that they would get that activity level up.
We're here with Catherine Huynh, licensed clinical social worker and also the outpatient program coordinator at JFK Medical Center North Campus, jfknorth.com, 2201 45th Street, West Palm Beach. Or you can call Catherine at 561-881-2692 if you want to talk a little bit with her about the programs that are available. What age range of people can your program help?
Okay, so we actually do have an adolescent program all the way on down to 99. So adolescents, 13 to 17.
Wow.
Adults, 18 to 99. And then even more focused, we have something called a senior intensive outpatient program. It's actually 55 and up.
Wow.
Knocking on that door to senior,
Yeah, everyone. That's great. That is a huge age range.
Yeah,
that's crazy.
And you're right. In fact, what happens is we made that senior program distinct because we wanted individuals going through similar life experiences to be in the same group, to make it more cohesive. They could really relate to each other.
Now, do adolescents have different mental health issues than adults versus seniors?
Right. When you think about mental health in general, similar diagnoses. But what happens is they are not as developed, developmentally. They have other issues related to someone who is, older, who have different life stressors. But the diagnoses are similar.
Okay. Well, we only have about a minute and a half left. Tell us a little bit about JFK Medical Center North Campus if we've never been there. I've driven past many times.
There you go. And we're
iconic
actually
building.
Right, we're on the corner of 45th and Congress. We're very close to the 95 exit. I find that the hospital is a small community hospital, right? We have a medical side and we have a mental health side. Our mental health program is pretty large. In fact, in the HCA, it's actually the second largest for behavioral health. So
Wow.
we service a lot of people in the inpatient unit, which is the hospital. And then, of course, we have the outpatient programs. So our JFK North Campus has both hospital and outpatient services.
That's great. What a resource to the community. And like you said, community is very important.
Yeah.
Again, Catherine Huynh, licensed clinical social worker, outpatient program coordinator, JFK Medical Center North Campus, jfknorth.com. There's an easy URL
Yeah,
for
I like it.
everyone. Much easier than some of the typing we have
Yes.
to do. Ton of programs there, or you can call her at 561-881-2692 for the blues, depression and other things that may be bothering you. Just talk to someone, like Catherine said. We'd love to have you back on
Thank
the program.
you. Thank
That
you for
was
having
great.
me.
Thank you, and we'll
All
see you
right.
next time
Thank
on the
you.
Living a Longer and Healthier show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or